So you know it's kind of like a tight squeeze. Yeah.
Caitlin Meyerly, a second-year med student from the University of Saskatchewan's College of Medicine, is treating her patient at Saskatoon's Switch Wellness Centre.
I think that it's really valuable for us as students because we get the opportunity to work with populations that we might not get to see every day in the hospital. And that's necessary because that's going to make us a lot more well-rounded. We're going to know how to communicate with people from different cultures, from different backgrounds.
Caitlin has been a volunteer at Switch for 2 years, working closely with professional healthcare mentors and students in a variety of fields, including physiotherapy, social work, nursing, and childcare.
Switch is an interdisciplinary health clinic run by students, managed by students. We want to kind of enhance the education of future professionals while we're helping out people in the community.
The students always go in first, and so myself and usually try to go in with a student of a different discipline, and so we'll go in together, get to like take a full history and talk with the patient, see what's going on with them, and then get to do a full physical as well, and so the hands-on is really great.
Perfect, 37.1, and that is just fine.
They learn to work with other disciplines, which you don't necessarily see during your training in medical school anyways. But in the hospital, when kids are admitted, it's difficult to forget the disease and think about the social situation. While I think that here, because of the multidisciplinary setting, because we're in the neighborhood that we're in, it's easier. We understand the effect of poverty and of other challenges that patients who come here have, for example, systemic racism or low education levels, addiction, etc., etc.
Being able to like receive that mentorship from physicians and like watching them interact with patients in like a very friendly environment where I'm not being quizzed or tested has like made it very comfortable to learn in, and I can apply that to patients that I'm going to see in the future, and hopefully that's going to make me a better physician.
And when students aren't with their mentors caring for community members, they can be found in the kitchen preparing small meals for patients and catching up on homework.
We see them grow and we see them learn and we see how well they're doing, but also it keeps us on our feet because they read a lot, they question a lot, so through them we also learn. So that's what I like about teaching.
Are you able to move the full range of motion of your ankle?
The hands-on training offered through Switch benefits the students, their mentors, and with newly extended hours, the clinic is now more accessible to those who need their services.
Members of the community can come in any Monday or Wednesday evening from 5:30 to 8. And also Saturdays from 12:30 to 3.
Hi, my name is Megan. I'm the shift supervisor tonight. How are you doing?
It's a great experience for those students, and they're not here just because of school. It's because they want to make a difference in the community.
Switch is run out of the Westside Community Clinic on 20th Street. To learn more, visit switchclinic.ca.
And then we're going to send some students in to come see you. But don't worry, no decisions are going to be made without a certified doctor.